Hi, thank you for joining me today. My name is Holly Desimone, and I will be reviewing with you the application process for the UNI Negative Pressure Wound Therapy Black Foam Dressing Kit. Before you begin any negative pressure treatment, you of course need a physician's order, and what you want to do is review all contraindications and warnings before beginning therapy. I'm going to leave these two screens up for a few minutes so that you can just review at your leisure. Here we will review what wounds are appropriate for negative pressure. Negative pressure can be used on many wounds. Your acute wounds, your surgical wounds, even your chronic wounds can be re-stimulated at times by negative pressure. Vascular, arterial, diabetic wounds. Also, some places will use it as a wound drainage management system. You can use it on pressure ulcers, stage 2 through stage 4, and many doctors will order negative pressure after placing grafts. Just be sure to review what the specific orders are for that patient. Hi, just a quick clinical education note from me. As I said, I appreciate you joining me today in learning about the application process. Today we'll educate you on the basics, but I'm not able to know if the treatment is appropriate for a specific patient, since this varies greatly due to a patient's clinical circumstances and complexities. This webinar is created to give a clinician the basic concept and to review warnings or contraindications and techniques. Negative pressure is an amazing option in wound care, but it is not for every patient. So again, feel free to review those contraindications again, and if you want, contact me at any time for further information. You will receive a sterile kit of the UNI Negative Pressure Black Foam Dressing Kit. Inside your kit, you will find your hydrophobic black foam, UNI Drape, UNI Suction Dome, and a UNI adapter. There is a Luer lock system that also has a cap, which is great infection control feature. The items you need to collect before starting would be a good pair of scissors, skin prep, saline solution, and a wound measuring device. 4x4s are also helpful so that you can dry the peri-wound, and let's not forget a good flashlight. We need to get light on there so we can see those hard to see parts of the wound, and this will ensure a good assessment of the wound as well. Be sure to assess the wound to determine if negative pressure is appropriate for your patient. You want to clean your wound with saline per your facility protocol. It is especially important at this point or when changing a negative pressure dressing to do a thorough irrigation to be sure that all debris is flushed away. Use a proper PSI irrigation if possible based on your facility's protocols, and be sure to irrigate undermined areas as well as tunnels. Use a wound measuring device to measure your wound. Usually this is done every week, and then you'll be sure to document the measurements and keep track. Use some type of a barrier based on your facility protocol to protect your peri-wound. Often you will see skin prep, which now comes in non-sting and sting versions. The non-sting version actually takes a little longer to dry. So make sure that you fan it and dry it so that you'll be able to get that transparent to adhere later. You may also want to decide to protect the peri-wound even further by using some type of a transparent dressing before you actually apply the dressing. Here we're using an oil emulsion gauze to protect a bone that's exposed. The oil emulsions can also prevent possibly the foam from sticking to the actual wound bed. Just be careful because once they're in the wound bed, they tend to be a little hard to see, and we all know what goes in must come out. So make sure you document somewhere that that is in there if the physician okays that as part of the wound order. Just make sure that you also get that removed. This is our white foam. It's a hydrophilic foam, and it's usually used in areas such as undermining or tunneling areas where it has a greater tensile strength, as well as it likes water. It keeps everything moist. So in those areas that we cannot see, it's a good thing to use, and usually this is what a doctor will actually order. You might want to protect exposed bone, tendons. Our sheet will need to be actually pre-moistened before it's actually put into the wound bed. The white foam dressing can be easily cut to fit the area, and you want to make sure, again, with any foam that you always cut all foam away from the wound bed to ensure that no fibers fall into the wound bed. Here we're gently placing the white foam into an area of undermining. As you can see, I have left a large tail out so that there is no way that anything could get lost in an undermined area. We know that this is the undermined area that is actually going into very gently, but we want to make sure that there is a visual amount left that can be removed, so there is no way that something can get lost in those areas. This is our UNI negative pressure black foam. My suggestion here is to definitely have a nice pair of scissors so that you are able to, if you need to, fillet the foam, as well as create the proper depth and shape that will be needed for your wound bed. Scissors make all the difference here. As I mentioned before with the white foam, it's the same with the black foam. Do not cut the foam over the wound, as if there were small fragments, they could fall into the wound bed, and you want to sort of brush the foam off before inserting it into the wound bed. You can see here how the foam depth is a little higher than the wound depth. We don't want too much, but we want a little extra so that as it compresses, it does not cave in too much. We need to be sure that all dead space is filled so that the wound will heal appropriately. This is our UNI drape. And what I'm doing here is I'm basically trying to figure how much drape I'm going to need, because you don't want an excess amount of drape over the skin, but you definitely want enough that you're going to figure on a really good seal. I'm also looking for where I'm going to be cutting my, nickel size hole into the drape so that it will go over the center point of my black foam. And I do have to say here that this drape, I actually just love it. It's very easy to work with, and usually transparent dressings are a nightmare for nursing. This is a very simple 1, 2, 3 drape that I think you'll find that it will be very helpful. I find it easy to cut my hole by just folding the drape in half and cutting a small hole at this point. You wouldn't want to do anything as cutting a slit in the drape, because it could actually rip later and then you'll end up with a loss of seal. So just cut a nice clean hole in the drape at this point. Okay, so your hole is going to actually align over the center of the foam as we had spoken about, right here. And here I'm just making sure that everything's going to line up. And then the next thing I'm going to do, I'm going to peel off the tab 1 of my drape. Then I flip over my drape so that my sticky side is down, and I gently press down the exposed adhesive onto the skin. I'm not going to compress, I'm not going to stretch or push, I'm just going to do this in a very gentle fashion. It's very important that the drape follows the curves of the body, so you can see me here actually making a small cut into the drape so that then I'm able to follow the curves of the body and just gently follow the curves, make sure everything sticks down so that again I get a great seal. That's the whole idea of this. So this may help you actually avoid a leak. You want to gently seal around all edges, and again, never pull on the drape or press over the actual wound area. You're going to let the negative pressure actually do this later for you. Now, here I am, and what I'm doing is I'm actually removing tab 2 of the drape. you're actually going underneath the drape and pulling from underneath and sliding the cover off the drape. I'm following the body contours, and I am just gently making sure that all of my adhesive is making contact with the skin. Okay, so pull off tab 3 at this point, and as you can see, this is this nice part of the drape. There is a little bit of a ridge right here, a perforated edge, and I've got my arrow pointing to it. Number 3, all you have to do is with one hand hold this part, with the other hand grab at this little ridge and stop pulling and lifting. It's very simple for nurses, and you're not getting the transparent to get stuck all over your gloves with this system. Pull off the blue tabs at this point, and they just peel up very easily. This is basically how it should look at this point. So you can see this is a non-compressed area at this point. Our hole is in the center of our wound, and you can see that really there's no black going over any edges onto our good healthy skin at this point. Okay, we want to line up our dome before we actually decide to stop peeling off the adhesive. So we're looking to make sure that the hole in the black foam and the hole in the dome, or the dome top, is actually going to line up specifically. The other thing we're basically looking for here is how do we want to place the dome so that the tube exits correctly and to the best situation of that particular patient. Just easily peel off the backing from the dome. Here I am gently securing the UNI dome. I am not pressing, I am not compressing my foam. I'm just making sure that all of my edges are well sealed. You're going to peel off the top layer of the dome, and I wanted to, with this arrow, try to show that, again, to make it easy for the clinicians, there's actually a little bit of a perforation in the top of the drape of the dome, and the reason for this is so we can grab it. It's not always fun to be picking at the edge of transparent trying to get that top layer off. So there's this little serrated edge, and if you actually look at it, you'll be able to see it. You'll be able to just lift it up and peel around, taking it off easily. Remove the blue tabs, and I would do this gently just so there's no problems, but they will peel up. Just grab the edges and peel them back gently. It's looking very good at this point. You're almost finished. Connect the dome tubing to the canister pump on your negative pressure device. Then you want to turn your device on at the ordered negative pressure. The usual range ranges from 80 to 125 millimeters of mercury. Higher is not usually advised unless there is a very clear order from a physician. Now you're going to watch it compress. This is the part where all nurses, we sort of sit there and cross our fingers and hope for the best, make sure we don't have any leaks. But if you have taken time with your dressing, there shouldn't be any issues, and you should have really positive results. Here I'm just actually anchoring the white foam down to the patient so that, again, it's stopping that tubing from moving all around. What you don't want to do is a lot of upsite. At times maybe too much, especially for patient's skin, but you also don't want to put a secondary layer of a transparent over the entire dressing and over the dome, because there has to be a certain amount of air that is actually getting through the system, and if you do that, you may actually cause problems with alarms. I cut a strip of the UNI dressing transparent drape and use that to anchor my tubing. So here I'm just basically anchoring over the white foam that I've placed as a little bit of cushioning, and that can work for many patients. So here you have it after everything is compressed and it's working excellent, and everything is protected, and our tubing is also anchored down to make sure that it won't be pulled up. Here I did not use the foam, so this is just another idea. Instead, I created a chevron type of a anchor from the transparent dressing again. So the transparent dressing can be used for a couple of other things, so keep the little spare parts. You could also use pink tape, blue tape, or something else like a Hyperfix. to do that as well. The dressing is now complete, and it is important to monitor the patient and the device at this point. One other thing I would like to mention is we all like to put transparent on to make sure things stay, but we don't want to put an extra piece of transparent over the whole entire dressing that we just created, since we need some air permeability in order for it to actually operate correctly. So I hope this helped. Thank you for joining me today. Please contact me about other educational programs that I have created to help your staff and your education department. My programs are not product driven, so I think that I sort of create them to empower confidence in clinicians when dealing with wound care. And I would love to speak with you about my programs. You can email me at hollywcc@yahoo.com. So HOLLYWCC@yahoo.com. Thank you, and I hope you have a wonderful day.